This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, we have a question submitted by Jen. She asks, what are the side effects of hormone injections used in IVF?
There are actually very few direct side effects of the hormones. The hormones themselves don't affect the body particularly. The two things, let's start with the simple things first. Obviously, putting a needle in your tummy every day can be a discomfort. 99% of women manage it without much difficulty, either themselves or their partner or a friend, administering that once a day. As the hormones have an effect on the ovary to produce multiple eggs, those ovaries become more swollen, and that can cause discomfort. It's very rare that you would go to the point of saying it causes pain, but but the discomfort, bloating, is the commonest thing that women complain about. And then, obviously, the egg collection, there can be discomfort associated with that. Because we're putting a needle into an ovary that can have a little bit of bleeding, you can get some pain in the next 24 hours after a pain in the tummy from that. Again, that's not hormone related, that's just the effects of the treatment itself. Overall, one study one of my students did, measuring the weight of women throughout a cycle, showed that there was a gain in weight of something in the order of 0.5 kilo. But within a week to 2 weeks, that had gone. And that was primarily due to fluid retention, we believe. So that's probably one of the side effects. There have been suggestions that the hormones cause anxiety and stress, but it's actually not the hormones that do that. It's the concern about whether the cycle is going to work or not. So really, the hormones have little effect on your body other than what they do to do their job, which is stimulating the ovaries to produce multiple follicles.
Prof, did you cover the scans that are needed prior to egg retrieval?
Yes, so when we do a cycle of IVF, whatever, whether that be egg freezing or normal IVF, what we need to do is to be sure that when we go to collect the eggs, they've got the highest chance of being mature. In a natural cycle, that's around 14 days in a 28-day cycle where the woman produces the one egg. And generally, it's around about that time that the stimulated ovaries produce mature follicles. We do ultrasound for a couple of reasons to check that. One, on the ultrasound, we can actually see the follicles. We can count the number of follicles, but probably more importantly, look at the diameter of the follicles. What we know is that once a follicle gets over 17 or 18 millimeters in size, so that's around about bigger than a marble, we know that it is likely that the egg inside that is reaching maturity. So that's the point at which we make the decision to go forward to collect the eggs. Women normally have an ultrasound before they start treatment, at least a week or 3 or 5 or even 6 months before is okay, to check that the ovaries are going to be accessible so we can get a needle into the ovary. Sometimes they're hidden up behind the uterus and we have to think again. And to exclude things like endometriosis, and also to make sure that the uterus is the right shape. So when we put an embryo back in, the lining of the womb's good. So there's an initial scan then before we start treatment, and then usually we do a scan around 7 days into the injections, hopefully seeing multiple follicles in the order of 10 to 15 millimeters in diameter, and 2 days later repeat again, and by then follicles growing at about 1 to 2 millimeters per day, we're getting up towards getting ready for the egg collection. And once we've got 2 or 3 follicles 18 millimeters or more, that's the time that we know that it's correct to be giving the trigger injection, and the eggs that we retrieve are likely to be mature. when we do the egg collection, about 80% of these follicles, these little cysts that hold the eggs, will give us an egg. It's not 100%. So if you've got 10 follicles, it's likely you'll get 8 eggs. When we look at the maturity of the eggs, then particularly in women under the age of 38, something like if we got 10 eggs, we would expect 8 of them to be mature. Again, it's not 100%. Using ultrasound gives us the clues as to when the best time to go and pick up the eggs.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.